So I'm Dr. Chris McMaster from Dalhousie University, and I'm the lead on the IGNITE project, which is identifying new genes and therapeutics to treat orphan diseases.
What's your name?
Oh, I'm Tara Soller.
And I'm Kathy Soller. My daughter Tara was born 13 years ago, and she was born with familial exudative vitreoretinopathy, fever for short, which is a rare orphan disease. When she was about 2 years old, we participated with the doctors in our local hospital, and they commenced a research study to look for the gene that caused fever. So approximately 2 years after that, they actually found the disease, or found the gene that causes fever. Unfortunately, at that point, that's the first step. There's no treatments at that point. So it was a very significant first step, but it hasn't really taken it all the way to looking for treatments for that disease yet. So when Tara was 10 years old, the disease in her eye progressed such that she lost any vision that she would have had prior to that. So it's very frustrating for us going to the doctors and having them tell us continually, month after month, that there were no treatments for her, and watching her progressively lose her vision. So we're very happy to be participating in the IGNITE project, because the IGNITE project will actually, hopefully, take this to the next step.
Exactly. So the IGNITE project is going to continue with gene discovery to identify genes that, when mutated, are causal for specific diseases, because that is the first and necessary step that then allows us to move into the next phase of our project, which is to identify drug targets or drugs that we could actually use to treat orphan diseases. And we're trying to do this using two different tacks. The first is actually scan all of the known drugs that are currently being prescribed to see if any can be repurposed to treat orphan diseases, because that allows you to get them into the patients with a small clinical trial at a very compressed time frame and for a very small amount of cost. So that way you can move forward to potential treatment within a year. And if not, we can move forward into an entire new chemical entity or drug design protocol if we don't get a hit from the repurposing screens. And our hope is to slowly move our way through rapidly move our way through all of the diseases as we can, to actually find drugs that are ameliorative for a whole slew of orphan diseases prevalent throughout Canada. So this project started about 4 years ago. It was a previous Genome Canada funded project called AMGE, the Atlantic Medical Genetics Genomics Initiative. That allowed for the gene identification projects to be undertaken, including identifying the gene for fever. And this is a project that's, we think, added value to that by taking technologies that are new and exciting that are allowing us to now discover drug targets and drugs to treat the diseases. So the project itself is underway now for 4 or 5 months, but we already have drugs in hand that we're testing for fever itself, actually, and a couple other orphan diseases. Targets we like to hit, we expect to discover another dozen or so new causal genes, 5 or 6 drug targets, and have 2 or 3 drugs that are at the point where they could be, we could propose to move them into the clinic or preclinical trials.